All right, so we're here with Bippy. Hi, Bippy.
Hi.
How are you?
I'm good.
So Bippy is actually one of our employees' mothers, and she has kindly offered to help us demonstrate what I like to call a fake lift. Okay, and so a fake lift is doing everything I can do with injectable fillers, and then usually plus Botox. Today we're going to stick to the fillers because you can see that right away. To improve really pretty much whatever parts of the face we can improve injectably, and so it's something that has not zero downtime. There's usually 3 or 4 days of kind of puffiness afterwards. It's not terrible, but I wouldn't say it's zero downtime. But you can, as long as you don't mind people seeing you puffy for 3 or 4 days, you can do almost anything you want. So here are the areas we're going to concentrate on today. So take a look straight into the camera. So there's another video which we'll link here where we've done a real dedicated tear trough video. But this is the tear trough. It's the little emptiness under the eye, and it usually continues into just a little bit of malar cheek emptiness. I'm going to show you what that looks like when we fill it. So this is simulating filling that tear trough. It kind of hides the lower lid bag, and it makes the contour of the lower lid cheek junction convex and youthful rather than concave where you get the shadowing just underneath there. So that's one thing we're going to do today, and that's fill that tear trough. Do it on both sides. It's maybe a little more noticeable on that side. The next thing we're going to do is fill a little bit into the smile line, and that's kind of old hat. Everybody knows about that. We're going to go after a little bit of some of the deeper skin creases. The under eye, the smile line we can do with the cannula, and the cannula is a non-sharp instrument. It bruises and swells a lot less than needle sticks do. It actually hurts less too, which is great. These real superficial skin lines I still have to do kind of the old-fashioned way, using that tiny little kind of diabetic needle, because I need to be within the skin to make that improve. Now the real trick here, the real fun part today is going to be shapes. So filling lines is good, but filling shapes is better. Or building shapes are better. Your chin just notch and give me no smile. So she's got just the beginning of a jowl. Okay, and often when we're treating this surgically, we're lifting that jawline, and that really works well, and it's actually probably the best thing to do, but it's got about a 2-week social downtime. The other thing we can do is we can rebuild the jawline to hide the jowl. So if you look creatively, you can see there's a triangle gap between the back of the jawline and the bottom of the other proposed jawline. Okay, that new jaw angle, if we look at youthful faces, there's actually more stuff here. We actually become narrow and high at our jawline from the effect of the chewing muscle wearing away and reshaping the jaw. And so one way we can really improve the jawline non-surgically is actually rebuilding that corner of it. Similarly, she's got less of this. We're probably going to do very little here. There's a little bit of a gap usually in front of the jaw, but there's really not as much to go after. It's more the back edge here. Okay. In general, we like to use stiffer fillers when we're recreating shapes. We're also going to use a little bit of a stiffer filler up in the cheek area. We're not going to make her look all cheeky or anything, maybe temporarily, but not in the weeks and months basis. And then we use thinner, finer fillers, a little thinner, and then really thin and fine as we go under thin skin and within the skin itself. Sound like a plan?
Sounds like a plan.
All right. Eyes up, you're going to fill one pinch here. This is the worst part of the under eye. You okay?
Yes.
Okay.
That's the worst part.
That's the
It's
worst
good.
part, believe it or not. Let's get started. Eyes up to the ceiling. Most of this you're not going to feel. You may feel a little, you will feel wiggling. You probably won't feel any pokes at all. Once in a while, it'll make a liar out of me. You'll feel a little poke, and that doesn't mean anything bad. It just is. Chin down just a hair, and look straight ahead. So that's one under eye. Get a process one. Kind of keep those coming too, Jenny. Mm-hmm. So that's one under eye. It really makes a big difference. All right, so we've done one side of the under eye. Her right under eye is done. Starting on the left. You feeling okay?
I'm feeling great.
Are you feeling the weirdness when you blink down that side?
Yes.
It wears away in about an hour.
Mm-hmm.
It's
tolerable,
different.
but it's different.
It's just weird, right?
Mm-hmm.
Eyes up to the ceiling. Let's make this one weird too.
Mm-hmm.
And again, most there, it looks like you felt a little jolt.
Little
Most
bit.
of it will be painless. Once in a while you'll feel a little jolt, but people usually tell me it's a 1 or 2 on a scale of 10. It's not a 8, 9, or 10. Does that sound about right?
Oh, yeah.
Okay, good. It's like being at the dentist where they're working on you and talking.
Yeah.
You start to feel the weird blink yet? Okay, look straight ahead again. No smile, just a neutral face. That's about right. Now I'm going to work on the smile lines and cheeks. So you got brand new pokes. Aren't you excited?
So excited.
Okay,
I
good.
love
Here's
them.
one. Another poke.
Mm,
As I do this, you'll feel it most in the top corner,
okay.
and then very little else other than that. There's that top corner.
Mhm.
But it's short term.
Mhm.
There it is again. So sorry about that.
That's
Good. And again, there's a little bit of numbing mixed into this filler. So I'm going to do a little bit on this side, and I'll come back and finish here, and you'll feel it less.
okay.
Turn this way just a notch. Same thing. And we can always add a little bit. And I know it's our first experience with fillers, we're not going to go over the top. But so far I've used Restylane under the eye, a little bit of Juvederm in the smile line. We're going to go after the cheek just a little bit. Same kind of thing. You can close your eyes if you want, you can look up if you want, whatever's convenient. Doesn't make much difference. And here you'll feel a little bit, and you'll hear weird sounds. There we go. Sorry about that.
Mhm. Oh, I heard that.
Isn't that weird?
Mhm.
I heard you too bad. Is it mostly just kind of the weird wiggling
Right.
noises?
Mhm.
Yeah. And so baby's having a pretty average experience. Because this instrument doesn't cut, it bumps across a bunch of things, and you feel these little bumps and clicks. And it's not painful per se, but it'll kind of make you a little startled, and that's totally normal. Look straight ahead again. That looks really good. Now
That
we're gonna
doesn't
go ahead and
hurt at
continue.
all.
Doesn't hurt. Okay, good. So we're gonna go ahead and continue. Do that same kind of thing over here. Okay. Turn your chin toward you just a notch. Do that same thing, and you can close your eyes. You can look up. Whatever's best for you. One of those clicks and pops.
Yeah.
All right, so we've done baby's under eyes and mid face, and we've done them conservatively. We're going to come back in a couple weeks and do some finishing touches under her eyes there. Now we're going to go work on the jawline. Okay, and the goal of the jawline. Now we're going to come back and work on the jawline. The goal again is to get that triangle back here built back. Okay, rest your head back there for me.
Mhm.
You're going to get one pinch here, 1, 2, 3 pinch. Those pinches are kind of the worst part, aren't they?
Yeah, they're pretty easy.
They rarely even bleed, so sometimes it's hard to find where I went.
Mm-hmm. Someone's going to be made.
You know what, out of all the ones they've done, just one.
Really?
Of course, it was the first one
Mm-hmm.
that you apparently got it out of your system. So you see, even just from the first little bit, it's starting to build that jawline. And it really does take a medium amount of filler to really make a difference on the jawline. And so again, we have a program here where we sell a few at a discount. I'd rather sell you a few at a discount and have you walk out of here happy than under-treated at full price. So once we get past 3 syringes or so, we really kind of do more of a face approach rather than a per syringe approach. So afterwards, I just want you to be gentle with your face till tomorrow.
Okay.
So again, what we're doing is recreating that jawline. And there's a little bit of a corner left right there, which I would do on a male, but I wouldn't do on a female. I think sometimes it's a little nicer to have a little bit of a rise in that back corner on a female jawline, a little more of a curve than a corner. So, yeah, okay.
Mhm.
I usually do this from the front, but I'll block your view, Julie, so we'll do it from the side. So this is Perlane. It's also going to be known as Restylane Lift here within the next several weeks. Perlane, Restylane Lift, Voluma, Radius, they're all the stiffer fillers that we have. And they do a better job at building shapes, like jawlines and cheeks. Maybe a little too stiff for lips, or too stiff for the lines around the mouth, or the smile lines or under the eyes, but they're great for Jawlines and cheeks. It's starting to show up already now with the new ACC, so. Alright, if you take that for me and take a look.
Oh, yeah, I can tell. Big
Isn't that
time.
neat?
Mm-hmm.
So what we did so far, where do you feel like you see it the most?
Here.
Yeah, on front view,
Right
where you
here.
appreciate it most on yourself is restoring that convex arc in the front of the cheek. And that you can see in the mirror. You can see it right away.
Yeah.
For your jawline, you'll actually better we'll take your sideways pictures and show those to you.
But I
Because
can
it's
tell
hard to
easily
see your
that-
own jawline on the back. Thank God I don't want to see my own jawline, but for both of us, it's hard
But
for
I
us
can
to see
tell
it.
though,
Can
because
you see that already?
that thing used to bother me.